Hello, and thank you for joining us today for the webinar titled Preparing for an ISO 1725 Audit, What to Expect from a LIMS. I'm Shonali Paul, COO at CloudLIMS.com. I'm here to moderate this event. Mr. Arun Apte, CEO of CloudLIMS.com, is joining us today as the presenter. Arun is a serial entrepreneur and laboratory research scientist specializing in bioinformatics. He founded CloudLIMS in 2014, bringing the benefits of a SaaS product to the laboratory market. This has enabled hundreds of small labs, including biorepositories, clinical research and diagnostic labs, food and beverage, and cannabis testing labs, to gain the efficiency of a LIMS previously only affordable to large laboratories. Prior to founding CloudLIMS, he founded Premier Biosoft, forging strategic partnerships with Thermo, Agilent, SciEx, and other mass spectrometry instrument companies. Arun holds a BA in molecular and cell biology and biophysics from the University of California at Berkeley. He has several publications on bioinformatics. Arun, I would like to extend a warm welcome to you. Before we get started, I'd like to go over a few points so that you know how to participate in today's webinar. All attendees are in mute mode throughout this webinar. This is an interactive webinar, so we encourage you to ask questions anytime during the presentation by entering them in the chat box. The questions will be answered during the Q&A session at the end of today's presentation. We will take as many questions as time permits. Due to time constraints, if we are unable to answer your questions today, we'll answer them offline. It is time now to hand over the floor to you, Arun. It is over to you.
Thank you, Shonali, and welcome to my talk on preparing for an ISO 17025 audit, what to expect from a LIMS. We're going to be covering what is the ISO 17025 standard. That includes the current standard as well as the update that was done in 2017, which is a fairly major update. Then why you would want to get ISO 17025 accredited. For those of you that are operating labs or planning on operating labs in states that legally require it, then it's quite obvious you need to do it for the legal reasons. But we have found that quite a few labs that are operating in states where it's not legally required still want to get 17025 accredited or follow the 17025 standards because it gives them better credibility for marketing reasons and it saves them money because they have to do fewer retests. Then we'll talk about how to achieve ISO 17025 accreditation. That will be the majority of the talk because we'll cover both the managerial and the technical requirements. And finally is the Q&A. So what is the IEC ISO 17025 standard? Well, it has 5 main sections: the scope, normative references, terms and definitions, management requirements, and technical requirements. The scope is basically the standard asks the laboratory that is applying for accreditation to define what it wants to be accredited for. So when you're doing your application for accreditation, you need to list out, I want to be accredited for a potency test. I want to be accredited for this particular pesticide test. If you later expand your laboratory's activities, say you were only doing flour before and now you're expanding to extraction and you want to be able to test for residual solvents, you will need to, you're not already accredited because you were only accredited for those particular tests, you will need to add the test and do an amendment to your accreditation so that these additional tests can be added. Okay, so this was the scope. Next are the normative references. This isn't very interesting. This is basically, there are a couple other ISO documents which by normative referral are included within the 17025 standard. Terms and definitions, self-explanatory. And then there are the management and the technical requirements. This will be the majority of the talk. We'll be going into quite a bit of depth on both of those two. So, as I had mentioned before, there was a major update to the 17025 standard. So this includes 4 major parts. One is the scope of the standard was expanded so that it covers not just testing, but also calibration and sampling. So you need to make sure all of your instruments are calibrated properly. And for the sampling, so this was a big issue in quite a number of cannabis labs where the sampling was being done by the grower and they could cherry pick any sample they want. So they could pick a big, beautiful bud that would have a higher potency. They could even go as far as using pesticides on almost all the crop, saving one plant that was not being treated with the pesticide and sending that plant in for the pesticide testing. So they would be selling a pesticide laden product, but would pass all of the tests. So the controlling agencies caught on to this. So now in quite a few states, the sampling must be done by the laboratory using random sampling techniques. There was a chapter introduced on risk-based thinking. There was an update to terminology. For example, there was a definition of a laboratory added, and this computer picture is that they finally acknowledge electronic record keeping. It took them till 2017 to acknowledge that most laboratories use LIMS and that the records are no longer being kept on paper. They're being kept electronically, primarily through a LIMS. So now I'm going to go on a little bit of an aside, which is, as members of the cannabis industry, I think that most of the people here in the webinar are going to be interested in seeing continued legalization. And I personally am quite interested in seeing legalization continue. This all depends on politics and public perception. So every time that the general public sees positive things about cannabis published in the media, it helps with legalization. Every time they see negative things, it tends to hurt the legalization. So these are some of the positive things that we've seen that mostly have to do with medical conditions. So this is Alfie Dingley. He's a boy in the UK who suffered from epilepsy. He tried all of the standard medications. None of them were working. Cannabis was fairly miraculous as confirmed by his pediatrician. He was administered cannabis oil under the care of his pediatrician. And both he and the school officials saw dramatic improvement. So there were quite a few articles. You can Google Alfie Dingley and you'll see all of that. The next is for pain relief. We are suffering an opioid epidemic in the US. The prescription drug companies have been pushing opioids hard. There is a massive epidemic of addiction. And so because of this, many people are looking for alternatives. And one of the best alternatives for chronic pain, which has no physical addictive properties, is cannabis. For them, they'll usually use indica strains, but this has been in the news quite a bit. The military and quite a few veterans groups are finding that cannabis is very effective in fighting PTSD. There's quite a few veterans that suffer from PTSD. If you live in a major city like I do, I live in San Francisco, there is something like, I think the last statistic I saw was 20% of the homeless population are vets and suffering from PTSD, among other things. So this can be a very effective treatment. So all of these things in the media help to promote legalization. So why did I include this in this talk on 17025? It's because we can't control those things, but we can control these, the negatives. So the negatives that we're seeing in the news have to do with tainted product, which is primarily people buying from the black market, and second, the fabrication of test results. So we indirectly remove products from the tainted market because as laboratories, we are testing white market products. And so that helps promote the white industry, which will hopefully displace the black market so that these tainted products are no longer available in the market. And this would in turn control this vaping epidemic, which is not a vaping epidemic, but a tainted product vaping epidemic. Next is fabrication of testing results. There have been multiple cases of this, where cannabis testing laboratories have fabricated results, and as a result, tainted products are being released onto the market. There is economic pressure on laboratories to pass products since the people, the growers, and the extractors who are paying the laboratories have a vested interest in making it press. They apply pressure to the laboratories, and unscrupulous laboratories have fabricated results. So there was a Canada-based laboratory that released, the California-based laboratory that released a lot of falsified testing results, and as a result we had the biggest recall in California cannabis history. This was a Sacramento-based laboratory. There have been other cases in Oregon. There was one in Washington. So there have been multiple cases of fabrication of testing results. So we, using 17025, can help stop that. In fact, the type of fabrication that happened could not happen if they were following 17025 properly, because every single change to a value is recorded. If they were using our LIMS, that would not have been possible, because any changed value, who changed it and when they changed it, gets recorded. So now let's talk about, we've talked about what is the standard. I did my little aside. So now let's talk about why you want to get accredited. If you're operating or plan to operate in a state where it's legally required, then it's a no-brainer. You clearly need to get accredited because you can't operate your testing lab without that. The second reason why you'd want to get accredited is for enhanced lab credibility, which is basically marketing. There are growers and extractors have a number of laboratories they can pick from. And increasingly, they want to be able to sell to the premium market. To differentiate themselves, among other things, they want to show they have a premium product. They want it tested by a highly accredited laboratory. So this is actually something that they can use in their marketing literature to talk about how well it's been testing and the reputation of the laboratory. And we're seeing this increasingly happening. So by being a well-accredited, by being a well-respected laboratory, which would include being 17025 accredited, you increase your marketability. The next reason is lower cost of operations. A number of things in 17025 are to avoid needing to retest or to minimize retesting. So for example, let's say you have a bad batch of reagent. With 17025, when that is discovered that that batch was bad, you will be able to pull, because in the LIMS, you'll be able to trace only those tests which were done using that bad batch, and you'd only have to do retests for those. If you're not following 7.825, you probably won't have records, so you don't know which tests were done, and you'll need to invalidate all the tests going back to when you first purchased that reagent, since you don't know which tests were done using that particular batch of reagent. And the fourth reason is reduced risks and liabilities. This is a very litigious industry, and so you want to do everything that you can to protect yourselves from lawsuits. In the event of a lawsuit, it will usually start with the growers, and it will usually start with the dispensary, then move to the growers and extractors, but eventually it ends up with the laboratory. So, legally required. These are 7 states. I operate in California, so I know about California the most, where it is legally required to have 17025 compliance. Some of them give you a little window, like you can start operating, and then you have a year in which to get accredited, but all of these ones require it. These laws are continuously changing, usually in the direction of increased requirements. So by now, there's probably additional states that require 17025. So if you're in one of these states, you're legally required to become accredited. Now, we discussed briefly why, even if your state doesn't do it, doesn't legally require it, you would still want to get accredited. And that reason is for enhanced lab credibility. It improves your marketing. If you are able to advertise, we are a 17025 accredited laboratory, and another competitor does not have that, it's more likely that growers and extractors will choose your laboratory over the non-accredited laboratory. The third reason is reduced operational costs. So you get increased results accuracy, productivity, quality, and lower costs. This happens for a number of reasons. One is It makes sure that only your trained staff are conducting tests. So you're less likely to have an error. You have measurement traceability. So if you find that something went wrong with a QC sample, you will only have to redo a minimum number of tests. We discussed what happens with a bad batch of reagent. If you have a bad batch of reagent, you know exactly what tests were done using that bad batch, so you don't need to do as many retests. So for all of these reasons, it actually improves your operational costs. So you have to spend more money to get accredited. It takes some time. You have to put the procedures in place. But once you've done it, your operations actually operate smoother. And with the increased quality, you generally don't need to retest. You don't end up having your systems go down. And for all of these reasons, 17025 accredited laboratories generally have lower costs, which allows you to be more competitive in the market. This is a major reason. As we discussed, it is a litigious industry. In case a consumer becomes sick, whether or not it was actually caused by a product or not, there will be a lawsuit. The lawsuit starts with the dispensary. The dispensary says, well, we just sell it. We got it from this grower or this extractor. And the growers and extractors say, yes, but this product was tested by Lab ABC. Lab ABC then has to produce all of the documentation to defend themselves from the lawsuit. ISO 17025 requires that all of this documentation has been produced and is easily available. So if your laboratory ends up getting sued, if you have 17025, you will be able to say, well, look, this instrument was calibrated on such and such date. The test was done on the calibrated instrument. The instrument was maintained. The personnel that conducted the test had been properly trained. Here's their certification course. This is the instructor marking them competent. These are the reagents that would use. You can see these reagents were used with the QC sample and yielded correct results. So it puts you in an extremely strong position. If you do not have this documentation, then that increases the chance of a lawsuit. If you have all this documentation, you have a much, much higher chance of having the lawsuit dismissed. So for all these financial reasons, these are why you want to get accredited. So we've talked about what is a standard, why you want to get accredited. Now let's talk about how. So we'll start, the two major sections are the management requirements and the technical requirements. So we're going to go over the management requirements. The first one is control of records. So control of records is basically when a sample comes in, you want to associate a barcode with that sample. And so with that barcode, you'll be able to pull up all the records for that sample. You want minimum access levels to those records. So in the organizational chart, and I'll be showing this to you in the LIMS, you'll be able to say technician A, who's only doing pesticide tests, should not have access to the records for potency tests. So it's minimum access. So all of this is part of your control of records. And finally, the final results, the COA, should only be accessible to the particular client. Next is document control. There are quite a few documents used within the laboratory. These are primarily your SOPs. So for every test, you have an SOP, and you want to have all of the documents produced, and when you do an update, the updates have to go through a process of approval, and then they need to be issued. You also need to do association. So let's say that a manufacturer of the instrument had a protocol. They update the protocol and they issue to your laboratory, here for our mass spectrometer, this is the new protocol that we want you to follow because it gives more accurate results. You'll want to update the document, the SOP for that protocol, and then you'll want to be able to have measurements showing which test was done using which protocol. So this is all part of your document control. Internal audits, this is where your laboratory conducts their own audits of each aspect of this. It could be document control, it could be organizational structure, it could be the validation, where you basically are checking that your laboratory is following it internally so that you don't get caught later on when you have an external one. Organizational structure. Your organizational structure is your org chart of the company, and you want to have within the org chart the minimum access level required for each person to do their job. So generally, the only person who will have access to everything is a lab manager, and individual technicians will be limited in what they have access to. Then we have review of requests, tenders, and contracts. This is basically losing business. You need to be prepared so that if, for whatever reason, you are unable to conduct a test and that test request comes in from a client through your client portal, you need to inform the client that you currently can't do the test. There's any number of reasons as why this might be happening. It may be that your technician, Susie, is the only technician who you have trained to perform the potency test. If Susie is on vacation or is sick and the test comes in, you cannot have a non-competent technician perform that particular test. This can also happen with your reagents or equipment. If you had that bad batch of reagents, if you have run out of reagent, if your instrument is currently down, if you've had a breakdown in your air conditioning so that you no longer are within the instrument specs for humidity or temperature, for all of these reasons, you wouldn't be able to perform the test and you need to reject it. You can't just go ahead and perform the test. Then purchasing services and supplies. You want to have a list of approved suppliers, and from that list of approved suppliers, every time that you purchase, you need to track expiration dates. If the reagent is expired, then you can't use it. With a LIMS like our LIMS, it will actually prevent you from using any reagent whose expiration date has expired. So now we'll go into a little more detail. When your sample comes in, you want to control the records by barcoding them. So here you can see a number of 2D barcodes. Labs can use 1D, 2D, or RFID. Almost all the labs that we've worked with are doing 2D barcoding. So the sample comes in, you would barcode it. You may then put it into separate aliquots and barcode all of those, but this system will track every sample as it moves through your system. Through that barcode, you have control of records because that particular barcode will pull up all the information about that sample. So this is the chain of custody samples. So you can see the particular sample is being transferred. So it went from user 1 to user 2, back to user 1, back to the administrator. So we have complete tracking of the sample as it moves through different hands. Just as a sample might move through different hands, a single sample, a test can move through different technicians within the laboratory. For example, you may have a test where technician A is doing the preparation of the sample for the test, technician B is actually conducting the test, and technician C is inputting the results, although hopefully you're using instrument integration, into the LIMS. So as this test is transferred from the administrator to user 1 to user 2, this control of records in the LIMS will track all of it. Document control. You have a number of documents, primarily your SOPs, that are used for different instruments. Here you can see we have different versions of a document being updated. You want to have each version stored. You need to know when it became active. It needs to be approved to become active, and then you need to be able to track which tests were done with which version of the SOP. For example, and this doesn't happen frequently, but if an instrument manufacturer said, "We messed up. The protocol we gave you has now been found to be defective and is not giving accurate results," you would need to be able to pull up all the tests that were conducted using that particular version of the SOP, because those tests would need to be redone. Organizational structure. So here you can see we have a number of different people within the laboratory. You've got a manager, a PI, a technician, lab in charge, visitors, and they all have different access levels. So this is what we discussed earlier, which is you want to have the minimum access level necessary for that particular user to do their job. So you can give them view access only, you can give them edit access, and you can pick which particular parts through the LIMS that they would have access to. And you always want it to be minimal. Review of requests, tenders, and contracts. So this is what we had said is losing business. I once was in a lab in Atlanta, and I walked into the lab and it was extremely hot and humid. So I said, "What's going on in your lab?" And they said, "Well, our air conditioning broke down." And I saw that they were continuing to perform tests. So I asked them, "Well, you have humidity sensors. Aren't you out of spec?" And the laboratory manager kind of froze because it hadn't occurred to him that the instruments would be going out of spec because of the humidity. And in fact, they were out of spec and they had to redo the results for that day. So the review of requests, tenders, and contracts is anytime, for any reason, your instruments are out of spec, your staff isn't available, your reagents aren't available, you need to reject the request, or at the very least, inform the client that there'll be a delay in doing it because you can't do it as per your normal schedule because of whatever the problem is. So review of requests, tenders, and contracts is the test request comes in. If you are all set up and everything's running smoothly, you accept the request. If you can't for any reason, then you need to reject the request. Purchasing service and supplies. So most laboratories will have a list of approved vendors from whom the technicians can order the supplies from. In addition to that, you also need to track all the expiration dates. So here you can see for this hydrochloric acid, we have an expiration date. When you perform the test, this reagent gets associated with the test, and the LIMS will actually block you and say this reagent is expired if you try to associate an expired reagent with the test. Okay, here you can see we have tracking of all of the particular results coming in from a set of reagents done with for this particular supplier. Internal audits. This is what we had discussed earlier in terms of the fabrication of results. This audit trail prevents such things from happening because everything is traceable. Anytime a value is changed, so here you can see original values, you can see them being changed, you can see what the attribute is, when it was changed. Anytime anything is changed, it is traceable. You are able to find out who made the change, when they made the change, right? And sometimes there's even a space where you can enter why they made the change. So with this, since the results are coming straight in from a technician or from the instrument, any type of a fabrication that's being done is trackable. Or if you're accused falsely of fabricating results, you can go to the audit trail, show it to them and say, look, the values have not been changed. The values came in straight from it. So this helps you with your defensibility. So we've covered now all of the management requirements. So now we're going to go into the technical requirements. These have to do more with the training of your personnel and the maintenance of your instruments. So personnel. You have all of your staff, and your staff all need to be trained. Each particular staff member can only conduct tests on which they have been trained. Equipment, your equipment needs to be calibrated and maintained. Seems obvious. It's kind of surprising how many labs don't seem to know this and have to be taught that all of your equipment needs to be kept, calibrated, and maintained. Reporting of results, this is primarily to do with your COA. Every state has a different requirement for what needs to be on the COA. Our LIMS covers quite a few states. Whatever LIMS you're using, hopefully you want to make sure that that LIMS produces a COA which is compliant with the state that you're operating in. Test and calibration methods. So this is basically, you need to make sure that every method has been validated for the particular type of test that you're using it on. Measurement traceability. All of your sample tests need to be traceable back to the most recent QC sample. So generally what a lab will do is you'll run a QC sample. It could be a spike, it could be a duplicate, but you run a QC sample, then you run a number of samples for which you want the results, then you run another QC sample. So if there's any question as to whether the sample result is valid, you can trace it back to the QC sample and say, well, here you can see that when we had the spiked sample with the pesticide, it showed positive for that spiked QC sample. And then here for the sample, it's showing it negative. So we have measurement traceability to show that the test results are accurate. Ensuring the quality of tests and calibration results. This is a general quality procedure, which you normally do by having proficiency testing, by participating in different proficiency testing exams. One of the ones that we've seen used a lot is the Emerald Cup. So with the Emerald exam, they will send out a number of different unknown samples, unknown to you, known to them, to different laboratories. They'll put it through the routine process and they'll say each one will get a score based on how good and how accurate their test results were at predicting what those samples were. So regular participation in these ensures that your laboratory is giving good results and enhances your reputation. Staff and training. So here you can see we have a training course happening. All these people are in the training course, and the instructor decides who attended it, whether they were competent or not, and whether they can be certified. Only the people who have attended, are certified and competent, can be, through the LIMS, assigned to that particular test. So this ensures that you have properly trained staff and that they're trained for the specific test that they are doing. Equipment, instrument calibration, and maintenance. So here you can see we have an Agilent 1220 Infinity LC system. We can see when it was purchased. We can see when it was calibrated, when it needs to be calibrated next. It tells you whether that calibration is expired. The LIMS will automatically send you a reminder X number of days beforehand that you need to recalibrate. The same thing for the maintenance. And it has all of these subcomponents. So oftentimes you'll have a complicated instrument that has subcomponents, each one of which has their own maintenance and calibration schedule. The LIMS can track all of that for you, so you don't need to separately track when you need to calibrate each subcomponent. The LIMS will send you a reminder. Assigning competent staff. So we already saw how the staff are trained. Only ones who are trained and found to be competent can be assigned here to administer that particular test, or could be assigned as the custodian for a particular instrument. Reporting test results to clients. So when your results come in, they come in like this. You can see this is the analyte group. These are the analyte names. These are the values of the analytes. When these analytes come in, this is generally being brought in through a table mapping where the technician will be getting the results from the instrument that's been written to a CSV file. The technician will say, load, we'll do the table mapping, and the results come in like this. But that is not the best way. The best way is through instrument integration. Instrument integration is more accurate. It's more accurate because when you do that table mapping, and I've seen this happen in labs, if the table mapping is done on the fly, the technician can actually make a mistake and put the wrong column, mismatch the columns of numbers, and you end up with a whole column of incorrect values. Or if you're doing manual entry and actually typing in the numbers, there could be all kinds of typo errors. So you get much more accurate data by doing instrument integration. It also decreased your costs because you don't have to pay for the labor costs of having someone sit there and type it in, or even loading in the whole table at a time. So for all of these reasons, all of the analytical testing labs that we've worked with may start out by doing the manual loading, but they all want to move to instrument integration longer term. We support instrument integration through our CL bridge. So let me back up for a minute. These are your instruments. In a typical lab, the instruments will be writing the data through your local area network onto a local computer. If you are using an on-premise LIMS, the on-premise LIMS will take the data from here. With a cloud LIMS, there is one more step, which is we use a CL bridge, which takes the data from your local area network, uploads it into the clouds, and puts it into the LIMS. So now you have all your data flowing from the instruments to the local network, up through the cloud, into the LIMS. And if you set this up, it's very, very high throughput, extremely efficient, low labor costs, highly accurate. We also offer a bidirectional REST API, which allows the LIMS to control the instrument. This is not usually needed in the analytical testing labs, but we have it available just in case. We've normally seen this used in clinical labs for clinical analyzers. Customized COAs per state regulations. Every state requires different COAs. This is one of our COAs. I think this one is from Maryland. So we have compliant COAs for basically all of the states which have medical and recreational cannabis. Whatever LIMS you use, make sure that they produce a COA that is state compliant with the state you're operating in. Test and calibration methods, associating documents. So as we discussed earlier, every SOP gets associated with the tests that were done using that SOP. So because of this, you'll be able to pull up a test and know, did I use version A or version B of the SOP for that particular test? And with this is part of your traceability. You'll be able to, in case that particular protocol was invalidated, you'll know which tests need to be redone. Measurement traceability. You have all of these QC samples, spikes, duplicates, etc. You run them periodically. Here in the LIMS, this is where you mark that it's a QC sample, and this allows you to have measurement traceability, because for any sample, you can go back and say, look, 3 samples earlier, I ran a QC sample. You can see it matched what we had as the known quantity. It was spiked with this pesticide. It showed positive. So we have an accurate result for all of the samples following. Validate test result. Most laboratories will have a laboratory manager with a number of technicians. The technicians are actually performing the tests. When those test results come in, they need to be validated by the higher level person, the laboratory manager. So the laboratory manager approves the results that have come in from all of these various technicians. So this is the validation step. Associated instruments. Every single one of your instruments needs to be associated with the test result so that at the time of the association, you know that that instrument was properly calibrated and maintained. So again, when we talk about the defensibility, if the prosecution says, well, show us the records showing that that instrument had been calibrated properly. We don't know if it was calibrated. With the LIMS, you'll be able to easily pull up and say, here's the test. Here's the associated instrument. You can see at the time that the test was conducted, the LIMS shows you that it was calibrated. So all of this testing the quality of results can all be done automatically through the LIMS. So now we have completed all of the 17025. We went through the management requirements and the technical requirements. So now I'm going to talk briefly, because most laboratories are also required to follow 21 CFR Part 11. We'll talk briefly about it. Most of it's contained within the 17025 standard, but there are a few changes. It has 3 components: confidentiality of electronic records, digital signatures on electronic records, and audit trail compliance. The confidentiality is that you need to have a client portal that prevents other people from having access within your own organization to the org chart. You need to minimize it. The digital signature is you have the laboratory manager digitally sign everything, and the audit trail compliance is the audit trail I showed you earlier. You have an audit trail, so any changes that are made can be traced. Here you can see the confidential data access. So for every user, can be a different access level set. You want to always set this to the minimum access level. Authorized signature. So this is John Smith, the laboratory director, authorizing and signing this, as well as Joanna Black, the head of the department, also signing it. So this particular document will have 2 signatures going. So anytime you release a report, it needs to have the authorized signature. And this is the person who is certifying, and it's usually lab manager. These tests were done by the technician, but I have reviewed the test, and I am signing that, yes, these results are accurate. Dedicated section for the audit trail. Here is our audit trail. Here you can see any updates, who updated it, what the value was that they changed, where they changed it, when they changed it. So you have a complete audit trail. So in case there is any type of litigation that implies that there was fabrication of results, you can go in here and say, look, the result came in straight from the instrument, from the technician, and no values were changed. So we're coming to the end. We have gone over what is the ISO 17025 accreditation. It is the most important regulatory challenge, both if you're operating in a state where it's required, or even if you're not, you'll probably want to get accredited anyways for competitive purposes. Why you want to do it, as we discussed, for legal, competitive reasons, and it decreases the chance of any type of lawsuit succeeding. And finally, how to achieve ISO 17025 compliance. LIMS makes it easy to meet both the managerial as well as the technical requirements. Thank you very much. And I think we're going to be taking questions. Thank you.
Thank you, Arun, for that presentation. We have a survey on display, so please take a moment to fill it out before we go drive straight into the questions today. As a reminder, you can still submit questions through the chat box. We have already received a number of questions via email and through the chat, so I'll move straight on to these. So the first question we received today was that a lab has just started receiving test requests from their clients, and they want to get the lab accredited to the ISO 1725. So what is the time frame or deadline within which they should implement a LIMS to achieve accreditation?
Well, the quick answer to that would be right from the beginning. And the reason for that is because basically the total amount of effort you have to put in is saved. If you can actually achieve 17025 compliance without using a LIMS at all. You can use an all paper system. But why would you want to? If you do an all paper system, that means every single maintenance, calibration, QC sample, you're just going to produce reams and reams of paper. And when the creditor comes in, then you're going to have to go through all of those files in order to provide it to the accreditor. If you start with the LIMS to begin with, then when you actually go through the accreditation process and the audit is happening, all of your information is much, much easier to access. So you'll both have an easier time going through the 17025, and then you'll save the second step. Because if you've done all of this using a paper system, after you start getting lots of customers and you need to go to a LIMS in order to deal with that volume, then you'll need to take all of those paper results and input them into the LIMS. So you've basically done yourself a disservice, because first you have to go through all the work of doing a paper process to get the accreditation. And then as your volumes increase and you say, oh, well, we can't handle this volume using a paper system, and you upgrade to a LIMS, you need to take all of the existing paper processes and then upgrade them. So the sooner you get started, you reduce your total amount of work. Hope that answers your question.
Hopefully. So the second question we received was, there is this lab which is already ISO certified, but when they went into the validation process, they had a non-conformance for their LIMS. So what would you suggest here? How can the LIMS be validated?
So the best way to do that, and we actually have several customers who have done that, primarily those customers have been in the clinical research field, but it can be done for any of them, which is you need to stop getting upgrades. So what you would do is you would tell your LIMS provider, and we have several customers who are on the system, where we don't automatically give them upgrades. And the reason is because you need to have your whole process validated, including the LIMS at once. So you would have your workflows with the LIMS go through the validation process with the accreditor, and then at the conclusion of that, you would wait for a certain period of time when you change your workflows, and only then would you take the next upgrade to the LIMS. So we provide all of the documentation you need for the validation of the LIMS itself, but the main part is you want to get a validation done that includes the LIMS and not get upgrades to it.
So then we have received several product-specific questions. The first one is whether CloudLIMS has all the features that are shown today, or they are available as optional modules.
So we have basically, if you get the enterprise version, so I'm not a salesperson, so I don't know all the details of this, but if you get the enterprise version, you get everything you see, and all of the pricing is available on the website. So,
Okay.
And there's no additional cost, there's no add-on costs, and there's no upfront cost.
Right. And then the next question was about instrumentation and integration, whether we interface with systems, and are there any additional costs for the interfacing?
So this is the instrument integration. So you absolutely want to get your instrument integration done, because it both increases your accuracy, plus if you're getting hundreds of samples per day, if you're not using instrument integration, it's just too inefficient. So we provide all the instrument integration you need, and there's zero charge for it.
Okay. Then the next question was about audits, and if it could be performed by an employee of the laboratory. What are the qualification or the training that one has to undergo to carry out an internal audit?
So absolutely. Internal audits by definition are carried out by people within the laboratory, usually the laboratory manager. So an example of a laboratory audit would be you would pick a particular sample and you would check whether the instrument had been calibrated properly and maintained properly at the time of that test. You would make sure that all of the samples coming in have been barcoded properly. So all of these internal audits are, you go through each step of your QC manual because you'll have a QMS manual. So for each step of that, you'll want to do an internal validation, usually not all at once, usually internally, but this does not get you accredited. For the accredited, you have to go to a third-party accreditation agency. We've worked with a whole bunch of them. There's A2LA, there's ANAB, there's Perry Johnson. One of their accreditation people will get you accredited. The internal systems are things that you want to do periodically, and the third-party accreditor will ask you for that. They will want to look at your internal audits as well.
So your answer beautifully lends to the next question that we've received is somebody's already paid us a compliment that they like the information that they received today. And they were wondering if there are any accreditation bodies and programs that we can recommend so that they can prepare for an external audit.
So I'm not officially allowed to recommend, but I really like A2LA people. We've worked with them a lot. They have very, very professional people. So I go to A2LA, but there's also Perry Johnson, there's ANAB, there's probably like 2 or 3 others. These 3 are the ones that we see the most, particularly for the cannabis industry. And you'll also see them like at every one of the cannabis testing focused conferences.
Right, and someone has also asked us about the LIMS availability for cannabis laboratories. What are the kind of LIMS available, and what would we recommend?
Well, so that question is a little hard for me to answer coming from the LIMS company, but I'm happy to give the names of, some of the other companies that offer LIMS in this space. One is called QBench. There's another one called LabDAC, but being part of CloudLIMS, I think our product is pretty good, right? And those other ones, they come with upfront costs and other things that make the financial part not as attractive.
So I think the time's up for today, and unfortunately, these are the questions that we can take up at this point of time. The questions that we were not able to answer today, we'll answer them by email as soon as possible. I would like to thank you all for joining us today and giving us your time. Have a great day ahead. Thank you so much.